following portion of Bloom is sponsored by Tampa General Hospital.
Being diagnosed with breast cancer is never easy, but thanks to incredible advances in treatment and early detection, more women are thriving than ever before. Joining me now to explain is medical oncologist for the Tampa General Hospital Cancer Institute, Dr. Victoria Rizk. Dr. Rizk, it's so great to see you again.
Good to see you too. Thanks for having me.
So how prevalent is breast cancer?
Unfortunately, it's becoming more prevalent with each year that passes. The statistic is same as it's been. It's 1 in 8 women will be diagnosed with breast cancer in their lifetime. And, unfortunately, that's something we need to continue to work on. And the goal is for us, if we are going to be diagnosed with breast cancer, to catch it early. And if anything, to prevent it from even happening from the first place.
So how far have treatment options come?
They have changed dramatically. I graduated from my fellowship in 2019. The treatment landscape has evolved significantly since that time. And over the last few years, we're actually now more advanced than we have been and much better at lowering the risk of a cancer coming back. So we're able to cure most early stage breast cancers. About 90 to 95% of breast cancers we can cure. And that's a statistic we didn't have before. So it's really reassuring across all the subtypes that we have improvements for women to do better with each day that passes.
What are some of the trends that you're seeing now when it comes to breast cancer?
Unfortunately, we're seeing it being diagnosed in more young women, and I think that's the most stressful thing because we don't have a good explanation for why. So a lot of people will come in with a common condition. They think it's mastitis, they were just pregnant or breastfeeding, and for whatever reason, those symptoms aren't going away. And in those moments, that's when their primary care doctor will think the most common scenario and give them antibiotics. And the reality is it was a breast cancer all along, but unfortunately, because it wasn't caught early, they get more advanced stages, more aggressive pathologies. And so treating those young patients, I think, is the hardest part of my job.
Yeah, I would imagine so. What messaging would you have for a woman or even a man who's diagnosed with breast cancer?
I would say just know your risk. And I know my last name is Dr. Rizk, but it's important to know your risk for a lot of different reasons, because once you know that information and understand your family history, what are the chances of it happening to you, because everybody's a little bit different, you might realize that you need to get high-risk screening, or you might need to change your lifestyle. There's a lot of different things that we can do, and the more aware you are, the better decisions you can make for yourself. So that's why at Tampa General, we've actually launched a high-risk breast clinic program, and it's virtual, so you can just self-enroll on our website, and then we'll do a virtual visit with you, go through your risk factors, give you a risk assessment, and then we'll put in recommendations for any risk screening that you might need, any medication we would suggest, lifestyle changes, get you a nutritionist, get you a genetic counselor. All of those things can play a part in decreasing the risk of developing breast cancer. So we're trying to help as much as we can to give people the tools to feel empowered to prevent themselves from getting breast cancer.
That is really incredible. Can anyone jump online and become part of this?
Yeah, as long as you live in the state of Florida, we're able to offer a virtual visit, and it's something that I'm really passionate about. So we've continued to expand this program, and we're able to reach more women because not everybody has transportation or childcare or time off of work to come for a visit. So by doing it virtually, you can do it from the comfort of your home and really get a good understanding and again, feel empowered to make those decisions and really change your health yourself rather than waiting for something bad to happen.
This is incredible. What a way to empower women to take their health into their own hands. Just another incredible thing happening at TGH. Thank you so much for joining us, Doctor.
Thank you. Thank you again.
All right, for more information about the TGH Cancer Institute, go to tgh.org/cancer. Bloom, we'll be right back.
The preceding portion of Bloom was sponsored by Tampa General Hospital.